Vasu has raised the hand. Yes, Vasu, you would like to go for the audience question already?
Actually, no, I had a question, but I think I forgot because
Alright.
I got
I have
engrossed in
one
listening
last
to the doctor. Oh, she was talking about something about the age of children of 13 who have not yet got. Actually, I was a little surprised, because I'm reading so much and trying to find information on what we can offer our audience. What was the word that you used and what can I read on that is what I was going to ask. You said about, what is the word that you used? Because premenopause we use for premenopausal.
No.
So you said
premenarcheal, like just before the.
Okay, so this is before also there is symptoms of PCOD. That's what you said?
Body symptoms. This was my first experience, but I was having past 5 years. I used to observe. I was getting patients, young girls, like 14 years, just after the menarche, like that. So that indicates that there is
that's
something.
What I meant, that just after the menarcheal is they started menstruating, or they didn't.
Menarche, yeah.
Menarche means the first menstruation.
Oh, okay.
So just before that also, because in PCOD, insulin resistance is a symptom or a sign also. Sign means what we can diagnose. So we'll get like black patches over, means blackish discoloration, not patches, discoloration over your neck and all, no?
There is an imbalance of hormonal problem.
Yes. So this insulin resistance means your body is producing insulin, but the body is not able to make use of it. That is called as insulin resistance.
Okay.
So this can later lead to diabetes. So that is another. PCOD is not at all about having irregular menstruation or not able to conceive and all. This is only the implication of reproductive system, but it is having multiple implications on multiple systems. One thing is like the predisposition to become a diabetic. So in this, why I mentioned that case is if any one of you having a teenager girl. So I was also someone who with an initial age of just after the period started, within 2 years, usually that our hypothalamic, that axis, hormonal axis won't be matured. So there can be dates changes and all. That is usually normal. After 2 years, within 2 years only, it will become mature. That's why we used to avoid other investigations and all in initial 2 years of this menarche. But now I can see that in that time itself, there is this predisposition. So if we are taking care at least but I don't ever want any girl child to go for a hormonal treatment or go for a metformin at that age. So there Ayurveda can beautifully help.
Okay, wonderful.
And PCOD is something which is not any medical system can do. More than that, your lifestyle changes can do. Whether it is Ayurveda, homeo, modern or anything, more than the medical systems do, your lifestyle changes can do. That we always want to know.
Thank you.
Thank you. There are a lot of audience questions already. I'm going to wind up with one last question as an audience, and I give it to Vasu. So my question was like, see, is there a connection with Ayurveda and massage? I think you answered partially about cleansing. And the second part of the question is like the massage is generally done by someone who's very young. Not the doctors connect you to that person and leave the premise. So is it a very authenticated, it's a good service? That's what I want to know. With this, thank you for answering all the questions. I hand over it to Vasu and you can continue to answer. Doctor, thank you.
What was your first question?
Massage and Ayurveda, how
coming to that. See, first of all, I want you all to let you know the pressurized massages or different manipulative techniques, these are not of Ayurveda. You might be shocked to hear that, but these are not of Ayurveda. Ayurveda's concept of this. I really don't want to use the term massage itself, but for your understanding only, I'm telling this. Ayurveda has used the term abhyanga, where it means oilation of the body.
Okay.
It has nowhere mentioned about the different manipulative kind of techniques, like in Thai massage or Swedish massage, all those things. No, these are all improvisations, or like maybe the commercialization part of it. But definitely Abhyanga is having a role where Ayurveda, as I told you, it has told about the well-being. So in that part also Abhyanga is mentioned, but that Abhyanga is not something what you imagine in this way massage.
Okay.
And Ayurveda has told that daily Abhyanga should be done some places, on shiras, on your ears, on your pada, means foot, like that. And Ayurveda make use of Abhyanga in treating diseases in where as a part of oilation.
Correct.
Then there will be some, according to, if there is a muscular thing, according to the need of that releasing, as you mentioned in my intro, no, in that way and all, we will make use of those techniques.
Yeah,
but
true.
Other things are not of Ayurveda. That is one thing. Second question is very relevant. That question itself has its answer. See, how can somebody go to a massager and think that they can treat like an Ayurvedic doctor, or somebody who has learned anatomy, physiology, or other things? And how a person who is not having knowledge in these things can treat you? For example, a cervical spondylosis. How a non-qualified massager can treat you? Right?
True.
That itself is the answer. So if you are going to a qualified doctor, she or he will be having qualified assistants, and they should not leave you to them. You will be under the supervision of the doctor. The doctor will be advising with what pressure it should be done, or with what technique it should be done, or whether you should not touch the patient at all. For some patients, I will tell, you should be just applying the oil. You should not keep your thumb at all. Like that, I'll tell.
Okay.
Yeah.
Okay.
But here also the common mistakes, especially in UAE, what people do now, I'm having a neck pain, let me get a massage done. Going to a massage parlor, or whether it is an Ayurvedic center also, they're not ready to see the doctor, thinking that a doctor consultation will be charged. Straight, no, it's okay, I'll get a massage done. How it is possible? It is not possible. So you should educate all your women that why we are educating in this way is all the blame will come to Ayurveda. The blames are not going to this particular therapist or particular person who did the massage. I've seen, I am having an experience where I got a patient with a severe intervertebral disc prolapse. He has a surgery advised patient, but he doesn't want surgery. Very educated man. He's an CEO of a company. Just imagine. What he did Ayurvedic treatment or massage or something from one Ayurvedic center years back. He had the contact of that particular guy. This guy was doing freelance practice here. He called him up, and he doesn't know anything about all this anatomy, physiology. He started doing his things. Naranya, Kiri, that, this, 10 days did. Definitely complicated. Then somebody referred to me. He came to me. I was so surprised with such a diagnosis. How you trusted a person like you, like that? Then I told that, yeah, surgery can be avoided or these things can be done. Then I told my therapist like this, not to touch the patient back. I did external therapies, but not to touch on that. No manipulations. I just applied some our medicines and all. We did this panchakarma. By God's grace, 90% of pain gone. So my point is, it's not something great I did. Ayurveda is having that power.
Yeah.
Never ever to non-qualified persons.
Thank you, doctor.
Thank you. Wonderful.
I don't know
Actually,
when you are when
one
you
of the
are
things I
keeping
love
this
that.
to when you are
Sorry.
keeping this to your channel, I don't know what will happen to me.
Nothing will happen. Don't worry about it. We are getting educated, and we want authentic people saying authentic things in our sessions. One of the beautiful things that you said is the oiling of your body. In the tradition from which I come from, I'm a Tamilian. We used to oil our body almost like every second day, third day. Take a oil massage by ourselves.
Yeah.
Because my mom will say, I can't do it, I don't have the
Yeah.
strength in my hand, you do it yourself. And we used to oil our hair, oil our
Yeah.
body, and our
Yeah.
skin used to be supple, hair
Mm.
growth used to be good,
Yeah.
and we have stopped all those traditional things that has been transferred from generation to generation. And we are
Correct.
actually going to a massage parlor, and thanks to you, I have not gone to a massage parlor, and I don't intend to go to one. But I will keep in mind, and I'm sure the audience also will keep in mind to check the qualification of the massager, whether they know the anatomy. Thank you so much. So we'll go to the audience question now.